Welcome to Spectrum Health TV. I'm joined by Dr. Thomas Malvitz, an orthopedic surgeon and chair of the orthopedics department at Spectrum Health, to talk about hip replacement surgery. Welcome, Dr. Malvitz.
Thanks for having me.
First question I have for you is, who is a candidate for hip replacement surgery?
Well, that's changing. When we originally designed replacements, the patients were usually in their 70s or 80s, and the reason is you want to do one surgery and make it last the rest of their lives. As patients are getting younger and still being active, there are more patients that are asking for replacements in their 50s and even in their 40s. But what's really critical is the patient's quality of life.
And what does the surgery entail?
The surgery involves replacing the ball and socket joint. There is a metal shell that's machined to fit the cup side, and there's an upper femur stem that has a ball on it that's different modular. They're different sizes that's placed in the upper femur. But it's a ball and socket joint.
And what is the recovery like in the hospital? How long are they in the hospital?
Most patients are in the hospital about 3 days. The surgery itself takes about 45 minutes to an hour to do. We let the people get up and walk on it immediately after surgery. They're full weight bearing with crutches or walker. And then the physical therapists and occupational therapists work with the discharge planners to try to determine when the patients are safe. But our goal is always to get the patients home. Some patients go to acute rehab or subacute, but it depends on what their home needs are. That dictates what we do.
And once they do go home, will they need help, and what can they expect the results will be?
Again, it depends on their situation. That's a good question. Depending on family members that are maybe available to help. But the majority of people are full weight bearing, maybe using crutches or walker until they're safe and independent. But they will have helpers that help to get their shoes and socks on and things like that. But that's what our discharge planning service helps arrange.
Well, thank you for sharing this information, Dr.
Pleasure.
Malvitz. It's been very informative. And I want to let you know that Spectrum Health has some great information about hip replacement surgery on its website. Thank you for joining us for this edition of Spectrum Health TV.